This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. Connecticut's two tribal-owned casinos have partially reopened today after being closed since March. Do you plan on going to Foxwoods Resort Casino or Mohegan Sun? Coming up, we talk to Rodney Butler, chairman of the Mashantucket Pequots and executive at Foxwoods, about the reopening and how he sees the casino industry surviving in a time when the nation is still dealing with a public health crisis. First, Connecticut Governor Ned Lamont joins us for the first part of our show to talk about the next phase of reopening our state. What questions do you have for him? Here's the number, 888-720-9677. That's 888-720-WNPR. As always, find us on Facebook and Twitter at Where We Live. Governor Ned Lamont joins us now by phone. Governor Lamont, welcome back to the show.
Good morning, Lucy.
As you know, widespread protests in our state and nation over the weekend, even earlier after the death of George Floyd in Minnesota. What's your reaction to what we're seeing yet again on our streets?
I'm totally, one with the people who are standing up and saying, how can this continue? We've had 4 of these incidents over the last 40 years. 50 years, 100 years in this country, and the progress is so slow. I also thank the protesters, the overwhelming majority of whom were peaceful, and I think that makes a much more positive statement about how we should all be doing better, but I take that message to heart.
You put out a video, I believe, early yesterday morning. You were wearing a black I Can't Breathe t-shirt, and you said, "Today we get up and fight for justice all over again." So as governor of Connecticut, Governor Lamont, how do you plan on doing that?
The first thing I wanted to do was make sure I had an administration that reflected the amazing diversity of this great state, and I think people know that we've done that. I made a big effort to do a better job of recruiting teachers, especially teachers of color as well as men, so that you had a teacher corps that reflected the diversity of our community, and so kids could have somebody they could identify with or somebody different from themselves who they could learn from. I said to the Black and Hispanic Caucus early last week, I need your help when it comes to recruiting not just teachers but judges and law enforcement officers. There we have a long way to go. So that's one way. I want to make sure that people look at their government and say, I think they're looking out for people like me.
What about police accountability, Governor Lamont? There have been situations in our state, as you know, of young men of color being killed by police in our state. And there have been police accountability measures in our General Assembly led by Senator Gary Winfield. But as governor, what more can be done, again, to hold police accountable so that people in our community, everyone, can trust law enforcement and not be fearful?
I think we've got to work much more closely with the community. Gary Winfield has been a leader on this. I want, police to be part of the community and the community to have confidence in there. And if there are bad actors or bad incidents, we just don't deal with it, but we deal with it much more expeditiously. I'm saddened by the slow wheels of justice sometimes.
When we think about systemic change, housing affordability, the fact that people of color who are living in poverty, they are shut out from communities that they want to live because there's not enough affordable housing. This is something you and I have talked about in the past, Governor. That's another way that change can happen. So as we look forward, obviously we're dealing with a public health crisis, this COVID-19 pandemic, but also the public health crisis of people dying and being fearful of the police. And so what can you tell me about how you can work towards making sure that our communities, again, the access, the benefits are open to everyone?
First of all, when it comes to housing, we've got to make this a bigger priority. I got to tell you, though, Lucy, up until recently, I thought housing, especially close to public transportation, made sense People weren't dependent on an automobile, could get to and from work a lot easier. And now you look around and you say, my gosh, public transportation in the era of COVID, we're have to take a look at this. How do we sanitize it? How do we make sure that people can do that safely? And how does that reflect housing? Maybe housing ought to be places where you can easier to walk necessarily than be dependent upon public transportation. I think COVID. I think we can't forget we're in the middle of a COVID pandemic, the worst this country has ever seen, and it can't be pushed from our consciousness. But it helps us rethink how we live, as you might say, and that includes housing.
You can join our conversation with Governor Ned Lamont, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Because we're talking about COVID-19, we know that more Black and Hispanic residents in our state disproportionately have contracted and died from this disease. How do you plan on addressing this? Let's talk about better access to testing. There have been issues with people who want to get tested and can't.
There's also been issues of testing is available and people don't necessarily want it. We were down in New Haven the other day, and it's no more drive-through because that's sort of self-selecting. But we had a walk-up test right in New Haven Green, and they had capacity to do over 100 people, and they had done 35 the day before. And so one of the things I did is I talked to the ministry, Black ministers and federally qualified health centers, doing everything we can to encourage people to go in and get tested. You know, make sure they know it's no cost. Make sure they know that if found to test positive, we can find a place for you to stay. We can make sure you get your meals. Make sure that you can keep your job. Do everything we can to remove any of the reasons people might be cautious. And by the way, that goes for, immigrants who aren't eligible for federal benefits, quote, undocumented. Tests, no questions asked, paid for. I want to make sure that everybody knows that we're in this together.
Steve's calling from Marlboro. Steve, you're on the show.
Oh, yes. Governor, thank you for your leadership on this awful crisis. We really appreciated it. I'm a 73-year-old man who doesn't have any symptoms and such, but I'm wondering whether or not we're going to see some guidelines that say whether myself, my wife, and others like us might be able to get testing just because, I go out and do shopping and I don't know, if I'm carrying something. I hope not. I believe not, but I want to be sure. So I'm looking for the new guidelines. Again, thank you.
Hey, Steve. Appreciate that good question. As you know, we now have broad-based testing. We're testing symptomatic and asymptomatic, as you were describing. I feel fine. I just want to get tested. We're prioritizing the first responders, the nurses, docs, nursing homes, folks who are regular back and forth with the public as part of their necessary job. We're going to be expanding beyond that very soon. We've got, a bunch of drive-in clinics where you can sort of self-diagnose on, say, CDC website, CVS website, and there you can go drive through and get tested. Really, no questions asked. So I'm creeping into that age group. We got to be very careful, Steve.
Glenn's calling from West Hartford. You can join us too, 888-720-9677. Glenn, go ahead with your question.
Yeah, hi, thank you. I just missed part of that conversation, so I hope this isn't redundant. But I'm 70 and, talk to friends and people my age, and they're assuming that the state wants a lot of people, as many people as possible, get tested. And then you hear stories that I don't have symptoms and I went to get tested, and they told me, well, you don't have symptoms, you can't get tested. So I just heard the last comment about CVS, but I also heard just something on national news about CVS, about the percentage of CVS outlets where you actually can get tested. And it's just very confusing, and there's just not one clear message. So I want to know, I'm 70, I feel fine, but I want to get tested because the state wants a lot of people to get tested, but I'm hearing that you need to have symptoms. So I don't get it.
Yes, Glenn, we were just talking about how right now we are prioritizing all those first responders in terms of asymptomatic as well as symptomatic, testing every single person in the nursing home, every single person in those very congested communities. For people closer in our age group, we're sort of still recommending you stay close to home. But there are a whole variety of drive-through testing where you can self-diagnose and be able to get the testing done and have your insurance to pay for it.
Governor Lamont, we keep hearing this, but again, people are confused about if they go to a website and if they don't have a symptom, are they going to be denied? Is there more that can be done? I know there's been so many mobile, testing sites that have popped up because of CVS, but for communities that don't have CVS, again, what are some other ways that your administration is talking about getting tests to people who want to get tested no matter the symptoms?
We're at the pharmacies, we're rolling that out at the federally qualified health clinics. I mentioned the pop-up testing, the likes of which we did down at New Haven Green. All those places you can get tested, no questions asked.
And so if someone doesn't have a car, there's more options for them to walk up somewhere and get a test.
Yeah, that's right, Lucy. We found... as we rolled out testing, look, we've gone from doing 20 a day to doing 6,000 a day, and we'll be up to 12,000 a day, and then I'll be able to say anybody can get tested virtually any time. We've got college kids getting back to college in a few months. I got to make sure we have testing so each and every one of them can be tested, especially before they go back to a residence hall. We're testing everybody that goes into the factory, say at Electric Boat. Just to make sure that in those congested areas, so to speak, you could be held, have a little more certainty. I know you've got Rodney on later. I mean, it'd be great if people were tested before they go to the casinos, where there are a lot of folks, a lot of older folks, Steve and Glenn's age, perhaps. Make sure they have testing available there before you go into a big environment like that. Right now, I think they are doing the fever testing, which is a start.
Is that something that your administration talked with the casinos to do, to actually have a testing on site?
Yeah, we had good, constructive conversations about a whole bunch of things you can do that would make opening safer. Nothing would have been safer than delaying it a little bit like our neighbors in the other states, but be that as it may, yeah. And certainly what they're doing in terms of the heat thermometers testing is a start.
Let's talk a little bit more about reopening. We're now looking at June 20th for phase 2. What does that mean in terms of what you hope to see reopen in Connecticut by then, Governor?
Well, first of all, we never really had a phase 1 in the sense that we never closed down our manufacturing or big outside construction. We never closed down retail, although for non-essential retail, we said it was for pickup only. Then, I guess it was 10 days ago, May 20th, we said outdoor dining. We said even Main Street retail with social protocols, with the mask, you can go in, tried to get retail going. We wanted to wait a few weeks, see how that is working. So far, it seems to be working well. And then in and around June 20th, we said that would be our next phase. And there we're looking at the potential for indoor dining, looking at hotels, looking at other ways we reopen. As you maybe remember, we also did churches and other religious gathering, open that up a little bit as of this weekend.
And when we talk about reopening again, that means that as more businesses open up, like recreational activities, I'm thinking outdoor amusement parks, even going to the movies, people will be told they have to have masks, Governor Lamont?
If you can't socially distance, if you're close in with people, you should wear a mask. It's required indoors. That is very clear. Outdoors, if you're standing watching a kid play softball and there's nobody around you, use your own judgment.
When we talked earlier with Commissioner Beth Bai, you had signed an executive order saying that residential sleepaway camps would remain closed this summer. Then you talked to Hearst, Connecticut, and said that maybe you would reconsider. So what is it, Governor Lamont? Should residential overnight camps remain closed this summer, according to what your public health experts are saying?
I think they're going to have to stay closed. I couldn't give a green light until, probably July, and when we can see exactly what the infection is and such. And people have said that's too late. We got to know now, or we can't do it this summer. And I can't give you the green light now, so we're not going to have sleepaway camps this summer.
We're up to, I believe, more than 3,800 deaths in Connecticut. I know hospitalizations continue to move downward. Has Connecticut flattened the curve? You're confident that reopening more businesses June 20th is the right move?
I am, as long as COVID behaves and as long as the great people of Connecticut continue to maintain their discipline. But you're right. I think we were really looking at April, early May as a time when our healthcare system could have been overblown. You saw what was happening in Queens. You saw what happened in Italy. And I think our hospitals work together very collaboratively. I think the social distancing made a difference in terms of slowing down the infection rate, slowing down the hospitalization rate. And that gave us confidence we could have another reopening on May 20th and June 1st today for a lot of personal services, including hair. And, by June 20th, I think we can continue a cautious reopening, provided all the metrics keep going in the right direction.
Mm-hmm. Rick's calling into the show. Rick, what's your question for Governor Lamont?
Hi, good morning, and thank you for all the opportunity. I got a question. I've been visiting different warehouses all the way around Connecticut, and I see those warehouses, they have stacks and stacks, a lot of boxes of Lysol spray. And you go to the store, you don't find anything else, anywhere around Connecticut. You go online, you can see online, different states has it. Connecticut doesn't have a Lysol. So Lysol has been one of the products that have been controlling the situation, the COVID-19, and we don't have it here in Connecticut. And I see this look like somebody is speculating with the products because right now the hand sanitizer is about $40 a gallon. And different brands, different people handling, but Lysol is no way to be found anywhere in Connecticut.
So, Governor Lamont, if you're hearing Rick about supplies like Lysol, you still can't find them in stores. He worries about how can you remain safe.
So, Rick, go to our DECD website, Department of Economic and Community Development. We have targeted all of the masks, Lysol, disinfectants, everything you as a family or you as a small business person need in order to be able to open up safely. We've got you pricing there. Some of it is a pricing we've been able to negotiate, so you know it's a fair price. And we can show you where there is also access if you need to find a place where you can get, in your case, Lysol. Don't ingest it.
We just have a couple of minutes left with the governor. Laura is calling from New Haven. Laura, what's your question?
Hi, thank you for taking my call. I wanted to bring to the governor's attention the concern around retail employees, specific to the reopening of the businesses, and not necessarily those employees who might come in contact with 10 or 15 employees, customers a day, but those who are working in the larger regional malls that may come in contact with several hundred customers a day. Potential for those employees to get sick and the potential for those employees to spread the virus when they go back into their community. And I want to highlight those older retail employees who may still be working in their 60s, waiting for retirement, and their high-level exposure, noting there's been no discussion at the national level or even at the local level respective of retail employees. We talked about first responders being a priority for testing. And
so you want to see more retail workers getting tested. So Governor Lamont, what can you tell her prioritizing this part of the workforce?
Yeah, Laura, that's great question. First of all, when it comes to retail, we've had a chance to look at some of those southern states that opened up, way before we did, just to get a canary in the coal mine, look at what's going on. We've certainly opened retail now, but in a limited way, making sure that all the distancing, all the masks, all the protocols, all the disinfecting has to take place. We've opened up a couple of hotlines, including 211, where if you are an employee and you feel like they're not operating safely and you don't want to say anything, give us a call. we'll make sure that we can go in and make sure that all those protocols are being done. And for those older guys in their 60s who are still working, I'm kind of empathetic to that group. My strong recommendation is don't go into work. Do not go into work. Most of these stores are only opening up at 50% capacity. I think you're going to find the customers are not all piling back in. So I hope to God that the employer follows our mandate. The people over the age of 65 should not be going into work, should continue to be able to collect unemployment if they were working before, and give that a little more time.
We're almost out of time, Governor Lamont. We talked just briefly about the casinos reopening today, partially reopening. Are you happy about that decision by the two tribes?
No, I wasn't happy about it. I thought we should have waited until late June, like our neighbors. I thought that would have been safer for employees, safer for customers, and safer for the region. And but be that as it may, I know Rodney's coming on. He's a good friend, and we tried to work together to find ways that they could reopen as safely as possible. And we made some progress there.
So you feel confident with the compromise that's been reached. Again, this is a sovereign nation. Both tribes, they can do what they want, but in terms of the safety measures they've put in place, are you feeling good about that at least?
Oh, yeah. I mean, at least they're not having indoor dining. I think they're not having indoor drinking, or I got to check on that.
I think there's still alcohol being served, yes.
Say it again?
There will still be alcohol served, I believe.
I guess that's right. Talk about straws and masks. It sounded not the way I would have done it. But look, we heard from Steve, we heard from Glenn, we heard from Laura. We heard about folks who are, older, over 60, over 65. And I would not be going to a casino right now. My age group, I just think it's really prudent to wait a little bit.
And Governor Lamont, lastly, we're hearing from a lot of people on social media. They're worried, today is June 1st is also when rent is due. What protections or measures are you giving to people that are worried about being evicted if they don't have their jobs and money left to pay for rent?
Lucy, we were very clear that no evictions are allowed. I think that extends at least another month and maybe beyond, depending on where we are on COVID. And I got to make sure that people know that your electricity can't be cut off, your cable can't be cut off, your rent, you cannot be evicted, provided you were in good standing before COVID. I think these are really important to make sure that we are able to get back on our feet on the backside of this crisis, when that may be.
And if someone does run into an issue with their landlord, who should they contact, Governor Lamont?
I would probably call our Department of Housing. I'd call that 211 hotline again. The courts are not, operating at full throttle, so I think that's going to be less of a relief. But the law is clear. I'll give you a call. Just we're not evicting anybody right now. It's these are some issues beyond your control.
Governor Ned Lamont, thank you for calling into Where We Live today. We appreciate it.
All right. Thanks, Lucy.
Coming up after the break, as we mentioned, Connecticut's two tribal-owned casinos are reopening today. We're going to hear from the chairman of the Mashantucket Tribal Nation, Rodney Butler, and you can join us too. Do you plan on going to Foxwoods Resort Casino or Mohegan Sun? You can join us, 888-720-9677. That's 888-720-WNPR, or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. We just heard from Governor Ned Lamont, who initially did not want to see Connecticut's two casinos reopen on June 1st, but the tribes have partially reopened. Mohegan Sun opened at 8 a.m. today, and Foxwoods opened to customers in the last hour or so. Joining us now to talk about his casino's reopening plan on Zoom, Rodney Butler, chairman of the Mashantucket Pequot Tribal Nation and executive of Foxwoods Resort Casino. Mr. Rodney Butler, welcome to the show.
Good morning, Lucy. Thank you for having me.
So we just heard from the governor a little bit about, again, his hesitancy that and not really wanting to see your casino or Mohegan Sun reopen. So tell us again why it was important to do it today.
Well, there wasn't specific around a date, right? It was around when we felt it was safe to do it. And so you have to go back to March 17th when we first closed. I mean, it was 11 weeks ago, and it's amazing how time has gone by so quickly. But in those 11 weeks, we've spent a lot of time analyzing what's happening around the country, what's happening around the world. As you know, I was on the Re-open CT Business Advisory Committee as well. And so, looking at the same data, we're looking at from a state perspective and the region as well, and saying, how do we best prepare to reopen? And so there was never a specific date in mind. It was just looking at the data and looking at all the protocols that we've implemented to open safely.
We're going to be hearing from a reporter for Connecticut Public Radio, Frankie Graziano, in just a few minutes, who's actually at Foxwoods to see what it looks like. But you also had a soft opening on Saturday. How many people were invited to come through? And walk us through what the casino floor looks like right now.
Yeah, and that's the perspective that you need, right? Because it's not the Foxwoods of 2 months ago, 3 months ago, certainly not the Foxwoods of New Year's Eve. As some might be concerned of. I mean, it's a whole new world. We only have 2 casinos open out of our 5, and that's the Grand Pequot and the Great Cedar Casino. Driving in, there's only 3 entrances, and each entrance is manned by security with temperature readers at each entrance, or signage that the governor had talked about earlier about warning people that are at risk of, over 65 and pre-existing conditions and the like. The restaurants are closed for the most part. There's just counter service that you can pick up and grab and go, and everyone's wearing masks and there's no smoking. I mean, it's a whole new Foxwoods. And really, the way that I describe it is that this is just phase 1 of many upon reopening, and we're just going to watch the data and work with the state and the surrounding region and safely continue to expand our footprint.
You mentioned temperature checks at the door. We just heard Governor Lamont say that testing patrons before they go into the casino would be something he would have wanted to see. Is that something that you talked about? Is that even possible to get a rapid test that quickly before someone comes in, because of the fact that a lot of people are asymptomatic, Rodney?
Yeah, I'm not the medical professional. We've consulted with countless ones in this reopening process. I think the testing itself takes longer than that, and so I don't know that'd be an efficient way. And so we felt, and all of the professionals we talked with felt, that having the temperature check is the best safeguard, at least initially. If someone does test over 100.4 degrees, they're pulled aside. They do a COVID questionnaire. And then they actually get retested. And if their temperature remains high, they're escorted. They're asked to leave.
Anne is tweeting us asking, will casino employees be regularly tested for COVID-19, Rodney?
So we're actually looking at that, right? We've had some constructive dialogue with both Yale and Hartford Healthcare about the science of that and if it's warranted. And it's interesting. I think every employer around the state is going through the same discussion in their minds of do you test every employee? Do you test them regularly? And if you do test them, how often do you have to test them to follow up, right? Because if I test negative today, can I be positive tomorrow and the like? So we're certainly exploring that. But as of now, we don't. The employees go through the same entrance process that the patrons do as far as getting their temperature checks. And they're asked questionnaires. We give them all a health questionnaire to see how they're feeling and look for certain signs of the virus as well. And we'll stay on that actively.
You're hearing Rodney Butler on Zoom here on Where We Live. He's chairman of the Mashantucket Pequot Tribal Nation and executive for Foxwoods Resort Casino. You can join us too. Have you been looking forward to the 2 tribal-owned casinos reopening? Do you plan on going, or maybe not? You can join us 888-720-9677 or find us on Facebook and Twitter at Where We Live. As I mentioned, Frankie Graziano from Connecticut Public Radio went down to Foxwoods this morning to see what it looks like in terms of people showing up and how the casino floor looks very different from what many of us are used to. Frankie, are you there?
Hi, Lucy. Nice to talk to you.
Yeah, thanks for calling in. So tell us, where are you exactly and what's it looking like?
I am at the Grand Pequot Tower at Foxwoods, which is open right now to 25% capacity. And just for ambiance, I'm walking a little closer to the temperature check area for you as we talk here this morning.
So did they take your temperature, Frankie, before you got in?
They did. I walked through the temperature scan. I didn't see exactly what the temperature was, but essentially what's happening is they're in this area, they're getting people off of the elevator. They walk through a cordoned off area that's very secure, and there's a thermal scanner that works with a camera, and those two work together to gauge folks' temperature when they walk in.
So tell me about who is there right now, and it was supposed to open at 9, so how did that go?
Okay, so it seems like there are a lot of people here. I'm not sure what it is in relation to capacity, but there's a good traffic flow of people in here. There was concern about whether or not people would actually show up today, but I think that's got to be allayed by the amount of people I see. And there was also concern about traffic flowing into the building this morning. But as you said, it did open a little earlier than 9. Officials decided to do that so that they could monitor traffic and get people in as easy as they could.
So tell me, when we just had Governor Lamont on, what are you hearing from guests? Are they excited, or in terms of why they showed up today?
Yes, really quickly, I did see, as I said, there's that bank of elevators that takes people through the secure area. And there was 3 women, a woman that's a mother, her daughter, and a sister-in-law. And they were cheering coming off of the casino. One of them said it was not early enough, I guess. They wanted to make sure they could get out here as soon as they could. So a lot of excitement from those guests. And on my way into the casinos, Lucy, I'll tell you really quick, there were signs outside. They're from the state, confirmed, that say, avoid large gatherings, don't gamble with COVID. So that's a bit of a state response to this reopening today.
Oh, that's interesting. And when we look at the people that you see, Frankie, we've heard the governor say several times before June 1st, he's worried about older patrons to the casinos because of the transmission and lethality of COVID-19 in the older population. So when you look around, are people all ages? What can you give us an idea of who you're seeing exactly in terms of age range?
Oh, just eyeing it. I don't want to sound discriminatory or anything like that, but it does look as though people that are of all ages, but mostly the older population. Because remember, it is 9 o'clock, and this is generally when you would see buses come through to the casino. I did speak with somebody who was a little bit older, maybe a little bit older than I am, Lucy, and they said if you're going to get COVID, you're going to get it. So no concern out of her at this time, and she had her Patriots mask on. So folks wearing masks here as is stipulated.
I guess she's YOLO, huh?
Yeah, you only live once. You only casino once, I guess.
Well, Frankie, thank you for calling in from Foxwoods Resort Casino today here on Where We Live. I wanted to go back to Rodney Butler. He mentioned something about buses not coming in. So when we talk about capacity, talk again about the measures you've put in place to help people socially distance when they're inside Foxwoods, Rodney.
Yeah, thank you, Lucy. And that's a great point. That starts before you get to Foxwoods. And so many people don't realize that we actually started closing down some of those high touch point areas of the resort before we actually closed the overall facility. And so like the buffet and poker and buses coming in from New York and Boston, we actually stopped those before we actually closed on March 17th. And so those areas in particular, we actually don't have dates for them to reopen. Because of one, the age demographic for events like bingo, and the close quarters in those spaces. So, with social distancing in general, again, everyone's wearing masks. In fact, with the soft opening, you mentioned that earlier, we had a couple hundred people both Saturday and Sunday, and it was really just to test procedures and get the employees ready. We are very strict on the that you must wear masks, and we actually had to eject 2 individuals over this weekend that weren't wearing masks. And so, it's all about safety, and we have a diligent surveillance and security crew that are focused on it. The staff are all educated on how to communicate with patrons and make sure that they're being safe and keeping their distance as well.
So keeping distance from patrons is one thing, but when you are playing games in a casino, you're touching a lot of things. How are you sanitizing the chips, the cards? I'm just curious if you could walk us through those measures. No,
great question, Lucy. So a couple things here. Casinos were, pre-COVID were highly sanitized and cleansed environments. And so we've really just taken it to another level. Again, with the spacing of the machines, we typically have we're 4,000 slot machines in play, and as we're reopening, we have just over 1,000. And so with their spacing, we can actually address them more quickly. And so when people play on a machine, they'll hit the call button, and immediately we have a cleaning crew, designated cleaning crew that walks through the facility and cleans every machine after each use. And then we also do a deep cleaning process. We partner with Ecolab, and they use this Decon 30 process that's used in hospitals, that kills viruses and germs. And then on the table games, we've spaced players out. Just for example, in blackjack, you typically have 7 players at a table. We have 3, and you have a plexiglass divider between each player and between the dealer. Dealers don't touch the card. I mean, the players they don't touch the cards. They do touch the chips, but in order to play at a table, you actually receive some hand sanitizer once you sit down. And then so when you're touching the chips, your hands are essentially at least freshly clean. The dealers are using hand sanitizer. And then as well, we're also spraying the chips regularly in between the hours.
You mentioned earlier that everyone must wear a mask. I'm curious about the foot traffic, the people that are coming in. Are they only going to be Connecticut residents? Are you keeping out-of-state residents from coming into your casino? How are you handling that?
So what we've done is we've focused our marketing efforts on Connecticut and Rhode Island residents only. I mean, being where we're at in southeastern Connecticut, I mean, essentially Rhode Island's an extension of Connecticut. When we look at the case count of COVID, there's much lower counts in Rhode Island compared to Connecticut, especially in relation to where we're at. And so our marketing focused solely on those 2 states, and we haven't done any marketing outside of this region. But if someone drives in from New Hampshire or Vermont or upstate New York, and they'll go through the same rigorous testing that any other patron coming into the property will go through. And so we're not gonna tackle people and turn them away and handcuff them if they're from out of state. But we're certainly focusing our marketing efforts on in-state residents for the time being.
Is that problematic, Rodney? Because we know that states, especially around the Northeast, public health officials are saying if someone is coming from out of state, say to Connecticut, or if we're going to Vermont, they say there should be a 14-day quarantine of that person before they, start moving around the state. And so, said you're not going to tackle people coming from out of state if they show up and you're doing the temperature checks. But is it problematic? Because as word goes that you're open and people are looking for something to do, you might see a lot more people from out of state coming to your casino.
Yeah, that's a possibility, Lucy. But again, the focus on the sanitization is the key, right? Everyone's wearing masks. We have hand sanitizers stations throughout the property, and we're constantly cleaning and wiping things down. And again, using the same system that you see in hospitals as far as cleaning.
We had the governor on earlier, and there's been a lot of attention on, again, he didn't want to see your casino or Mohegan Sun open. He was hoping that regionally the casinos would all open at once. But I want you to talk a little bit more about your relationship with the Lamont administration, because, again, the tribes have had a long-standing relationship with the state of Connecticut for decades now, and it just seems like there's a lot of butting of heads in terms of how do you reach compromise, whether it's this or earlier with talking about online betting. Before that, where do we put another third casino? I'm just curious what your thoughts are on, do you feel like the administration respects the tribe's relationship with the state?
I would say that, it's a learning process. It's a new relationship. Actually, I mean, obviously it's a long relationship between the tribe and the state. But every time there's turnover in the governor and their administration, there's always a learning curve where we have to figure out how we're going to work together. And yes, I mean, to your point, I would say in all instances, it's been incredibly cordial and open, and we've had regular dialogue. And even when we've disagreed, we just agree to disagree, right? But I think this process that we just went through and the consideration that the governor and his team had taken to add me to the reopening team really showed you the commitment to working with us. And even in this process, as far as reopening, the governor had pointed out that he was concerned or didn't necessarily agree with our opening date, but as of last week, he followed through, and we had regular dialogue with he and then his commissioners. And I just have to give a shout out to Commissioners Lehman and Siegel and Gifford, consummate professionals. They came down last week. They walked the property, both us and Mohegan, looked at our procedures and gave us some great advice and some great feedback on things that we could do and modify in order to open more safely. And again, not quite to the degree that the governor was looking for, but there was some significant compromise here. And so I think despite how we got here, I'm really encouraged by how we came together and what the relationship is going to look like moving forward. I think getting through this very challenging time just shows you what we're capable of doing, working together, and really optimistic about what's ahead for the state and the relationship with both tribes.
We're going to be heading to a short break in just a couple of minutes, but I wanted to ask you again, so important to contain the spread of this disease throughout all the measures, even if taking temperatures, sanitation. If there is someone who contracts COVID and they're traced back to coming to Foxwoods for a day of fun, what is the casino's response then in terms of containing the spread? Will you close if or a certain part of the casino will close? How do you deal with that kind of concern?
Well, a couple things there, Lucy. We've actually communicated with the state that we'll work with them, coordinate with them on contact tracing, and if there's an opportunity to do so. I mean, we have extensive databases. We know a lot about our players, and we can track them better than most facilities around the state. I mean, if you go into a Home Depot, if you're going to West Farms Mall, there's very limited opportunity to figure out who you're in contact with and who you're touching. And we know everyone that's in our building for the most part. And so, I mean, we'll be diligent. We'll continue to be diligent. Again, working with the medical professionals that we have, we feel like the sanitization processes that we've implemented should prevent or at least minimize those contact points and the spreading. And if there is a specific area, obviously we'll dive into that, or a specific department, we'll dive in there and do the deep cleansing and the contact tracing that's required.
You're hearing Rodney Butler on Where We Live. Again, he's chairman of the Mashantucket Pequot Tribal Nation and executive for Foxwoods Resort Casino. We're talking with Rodney today as Foxwoods and Mohegan Sun have reopened. You can join us too, 888-720-9677. After the break, we're going to talk about how all of this is impacting the casino industry, and we hope you join us too. You're listening to Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Today we're talking about Connecticut's casinos rolling the dice and partially reopening today, more than 2 weeks before Connecticut's Phase 2 reopening begins. They've been closed, though, since March. Do you plan on going to the casinos? Find us on Facebook and Twitter at Where We Live. On Zoom today, Rodney Butler, chairman of the Mashantucket Pequot Tribal Nation and executive for Foxwoods Resort Casino. And joining us now is Andy Rosen, business reporter covering the casino industry for the Boston Globe. Andy, welcome to our show.
Thanks for having me.
Part of the reason we wanted to have you on is because, again, Connecticut's 2 casinos are reopening, among the first in the nation. Among the first, there have been some others, but in the Northeast region, they are the first. How is Massachusetts handling their casinos?
Well, obviously, Massachusetts has a very different situation with its casinos. We came to the industry later than Connecticut, but a primary difference is that we don't have tribal casinos here. There's been a proposal for one in southeastern Mass for a long time, but it hasn't happened, which means that the casinos that we do have here, 3, one near Boston and Everett, one in Springfield, and one in Plainville, those 3 are in full control of state regulators and are essentially completely aligned with the state's reopening plan.
How has this pandemic impacted the casinos in Massachusetts?
Well, like every casino that's been closed, they've basically been cut off from all revenue. And remember, these are very new facilities. The one in the Boston area just opened last year. So these are places that are just trying to find their footing, and they're taking a very big hit. Some other states have some forms of online gambling, which casino companies are a part of. Massachusetts doesn't have that. So basically, they're just waiting. And it's been a huge impact on the workforce. I mean, in Springfield and Plainville, they've furloughed or laid off most of their workers since April. Wynn Resorts, the company that owns Encore Boston Harbor, they paid their employees up until yesterday, and many of them are still on the payroll, but they began doing furloughs. They cut their part-timers yesterday. So it's really starting to have an impact on an industry that spent a lot of energy trying to build up a workforce in a profession that didn't really exist here before.
Rodney Butler, what has been the impact? Millions of dollars lost each day that you've been closed?
Yeah, it's millions a week. And so when you have payroll for 6,000 employees and health benefits to follow that, and then just the infrastructure costs, the ongoing infrastructure costs, I mean, you can't shut down the building, right? And so you have basic maintenance going on, you have utilities you have to pay. And so, I mean, it's in the range of $25 million a month that's costing us to be closed.
What has been the impact on the Pequot people, the people that are part of your family, Rodney, because the casinos have lost so much money?
Well, that is the key question here for us. We're a tribal nation first, and we have citizens that have services just like any other state and municipality. We have our own fire and police and court system, education, healthcare, and the like. And so that's a double-edged sword. So we see the economic challenge of the casino being closed, but unlike any other state or municipality, we don't have a tax base here on the reservation, and so we rely on the gaming revenues to fund our municipal efforts, our government efforts. And so, we've had to cut back on programs, and in addition to that, most of my family members, most of our tribe members actually work at the casino. So we have an incredible level of unemployment on the reservation related to the casino being closed. And it's a challenge, but we've been fortunate. We've had literally one confirmed case of COVID amongst our tribal members, and that was actually not here on the reservation. It was externally. And so, everyone's healthy. My elders are doing well. And, I say this too. I mean, when we're looking at reopening, it just tells you the level of safety and security that we're focused on. I have tribal elders that work here at Foxwoods. And so I'm looking at it from a family perspective and the health and well-being of them and making sure that it's safe for them to return to work.
Before we end, Rodney Butler, I believe that your casino is hoping to operate it to about 30% capacity. But as you look at what happens in the next few weeks, do you anticipate that capacity will grow?
No. So right now we're at 25% capacity, but that's also a smaller footprint as well. And so if there is an opportunity to expand the footprint, we'd open up other sections of the building, but still running those at a 25% capacity. But this is all going to happen in time. I mean, next week is when Rhode Island casinos are opening up. Upstate New York facilities are opening up this week and next week. Delaware is opening up this week. And so the region is slowly starting to open up. And of the 989 casinos across the country that were all closed at one point, you've got almost a quarter of them that are reopening. So we're all going to learn from each other and expand appropriately. And again, continue to consult with all the health professionals that we have internally and externally.
I want to thank Rodney Butler again for joining us today, chairman of the Mashantucket Pequot Tribal Nation and an executive at Foxwoods Resort Casino. Rodney, thank you for your time.
Thank you, Lucy. Appreciate it.
Also, Andy Rosen was with us, business reporter covering the casino industry for the Boston Globe. Andy, thanks for your perspective.
Glad to be here.
Today's show produced by Tess Terrible, Carmen Baskoff on the phones today. Our tech producer is Kat Pastor. I'm Lucy Nalpathanchel. Thanks for listening.